Hi, my name's Richard Rahdon. I'm a plastic and reconstructive surgeon and I'm the Medical Director of Body Recon Cosmetic Clinic and Body Recon Plastic Surgery. I'm here today to talk to you about medical tourism or travelling overseas for medical procedures, in particular cosmetic procedures. Well, overseas surgery has become very popular lately, primarily for two reasons. One is that it can be a lot cheaper, or certainly seem to be cheaper, and people are very focused on price point these days. The other reason people may find surgery overseas appealing is that it seems enticing to combine a holiday with a procedure, but make no mistake that having an operation is something to be taken very seriously. Well, in plastic surgery, really the most common operation that people go for, or the most popular, is a boob job or breast augmentation. And this seems quite appealing because it's often played down as not being a major operation and would work well with a couple of days or a few days in a hotel afterwards. There are, however, a number of very, very serious questions that you need to ask your provider if you are considering overseas surgery, in particular breast surgery. The first thing to look at, of course, is the qualifications of your surgeon, and it's sometimes difficult to tell what those qualifications may be or where they're from, or indeed if they're genuine. But assuming your surgeon's fine, then there's a number of other things you need to check out. Firstly, for this sort of surgery, you're going to need a general anaesthetic, and that means going to sleep. Your life is in the hands of the anaesthetist. You need to be absolutely sure that the person putting you to sleep can wake you up again and can also do the whole process safely and with as small amount of pain as possible. So it's not just the surgeon and it's not just the anaesthetist that you need to worry about. There's actually a number of other very important people involved in the process of having any sort of operation, and in particular a breast augmentation surgery. For example, who is looking after the cleanliness and sterility of your instruments? Do they meet the high standards that we require here in Australia? Is every instrument that's been sterilised traceable with a sticker? If there are any problems, can you go back and find out where the contamination may have arisen from? There's also many other issues. For example, the water being used to sterilise instruments. Is it clean enough to use? Is it clean enough for the surgeons to wash their hands in? What about the nursing staff? Are you able to communicate with them in English? This is important if you need to tell them about pain or swelling or other problems you may have. There are also other considerations, such as the implants. Where are they from? Are they appropriately sterilised? Are they market-leading implants or are they cheap imports? It's really important to find out what's being put inside your body. It's important that you check what sort of follow-up you've been offered if you're having an operation overseas. In most cases, the follow-up is going to be extremely limited because you're usually only going to be there for a week or 10 days or so. If you do have a surgery overseas, it's important to ask if there's any arrangements made for your follow-up locally in Australia. The reason for this is that many complications don't occur just in the first few days, but they can occur weeks or months later. And if they do, you need to know who is going to address them and where they're going to be addressed. Well, complications can occur in any sort of surgery, and complications can occur either in the short term, medium term or long term. In the short term, particularly for a breast enlargement for example, the complications could be related to your anaesthetic, or they could be related to a bleed or what we call a hemorrhage or hematoma around the implant. Those complications usually require a return to theatre straight away. It's also worth mentioning that complications in breast surgery can happen many months or years following your original procedure. If you have your procedure done overseas, then you'll really need to go back there to have it looked at. If you'd like to have your particular problem sorted out locally, then it's much safer to have had a local surgeon performing your surgery so that you can have the same person sorting out your situation who knows you well. Some of the travel tourism companies have tried to have a solution to the follow-up problem. Indeed, some companies send their doctors from, for example, Thailand to Australia to see people in hotels and run clinics in hotels for follow-up. This, however, is illegal in Australia, as you have to be a registered medical practitioner in this country to practice medicine. It's safer to have your procedure done in Australia for a number of reasons. Firstly, Your procedure will be performed at an accredited facility that meets Australian standards for sterility and cleanliness. It also means that you're likely to have somebody who is more qualified to do your surgery and more qualified to give you anaesthetic. There's also rigorous tracking procedures for sterilisation and accountability if there are any problems with these procedures. It's also illegal to use implants in Australia that are not approved to appropriate standards. In most cases, you're safest having cosmetic surgery performed by a plastic and reconstructive surgeon who is a Fellow of the Royal Australasian College of Surgeons and a member of the Australian Society of Plastic Surgeons. Here at Body Recon, we of course have the appropriate qualifications to look after you, and importantly, you have the backup that you can trust. We have a day surgery facility that's won an award for being the best day surgery facility in Australia for 3 years running, with fabulous staff that have been there for many years and know the procedures extremely well. We can trust our CSSD, our sterilising department. We can trust our anaesthetists, who are all specialist qualified anaesthetists, and we can trust our fantastic nursing staff who you'll easily be able to communicate with. Importantly, you've got superb backup here at Body Recon. In Australia, it's also important to note that you have the right to recourse if there has been any medical misadventure as a result of negligence. In this country, you are protected by law, and I'm sure that's not the case overseas. Breast surgery is complex, and very few cases are straightforward. But if you are considering surgery overseas, it's important to ask the right questions. And the most important question to ask is it worth the risk?